Hey everyone, this is Megan
and Darla. We are your hosts of the Enlighten Benefits podcast.
Our goal is to help you understand all things insurance. In each episode, we will tackle the confusing topics and terminology as it relates to insurance.
We want to create confidence over confusion and make insurance suck less.
We hope you enjoy our show. Hey Darla.
Hey Megan.
How are you?
I'm good.
Good. Got everything ready?
Got my coffee, and actually coffee and tea today. I'm going to tell on myself. I'm double fisting it.
Double fisting it.
Yep.
So today we thought we would talk about all things insurance as it relates to human resources.
Great idea. Overall, Enlighten Benefits, that's one thing that we really get excited about, is digging in the weeds and trying to come up with something that is a little more creative than what you're currently doing, but also to save time. Everybody wants to save time and money. I think that's just the ball of it. I mean, that's just wrapping it up in a ball.
I completely agree. And I think that it's important for you and I, whenever we go in and work with a new team, it's to figure out what is their pain point, right? So for example, we may have one group that is so frustrated by their billing. They've got, 7 different carriers that they're getting bills from, and, they just feel like that their billing experience is all over the place. And then we've got other groups that are like, no, I feel like our billing is going pretty good, but goodness, adding and terming, we have a high turnover of employees. That's my favorite part. I have a lot of favorite parts of our job, but one of my favorite parts is really figuring out what is their pain point and helping.
Yeah, I mean, that's one of the great attributes of being a broker,
right?
Is, you get comfortable with your HR team, you build that relationship. And I always, I would just like to say we would take as much off of your plate as you would let us.
Right.
And who wouldn't enjoy that?
Well, some people don't. I mean, people like me who are control freaks and they want everything at their fingertips. So
could run into a few of those. Yes.
Yes, we could. So with billing, I mean, I hear you say, I know you love to say the words bundle and save. So let's talk a little bit about billing and how, things that we've uncovered in the workplace of billing catastrophes, I guess, and how we helped solve that.
Yeah. Just always to use examples, running across someone and you're sitting down in that fact finder meeting, the first time you get in front of someone, an HR director, and you find out their current coverages. We always get a list of their bills, what they're currently doing. We'd like to propose an RFP. So as we're digging in those weeds, if you will, and they lay 8 different bills on the table, one for medical, one for dental, one for vision, one for group life, one for ancillary. I mean, I could go on and on. One of the first things my eyes open to, and the first thing out of my mouth is, would you like to consolidate that down to one bill? Mm-hmm. And to see the look on their face whenever you say that. So I know there are insurance companies that say bundle and save. I know you've heard that 15 times, but I think you see a lot of your major carriers come in now, and they have really worked with us as brokers to develop those discounts and incentives for the employer to put all those benefits together.
And it doesn't always work out that way. I mean, there's a lot of times that, as we're getting in and we're visiting with the group and we figure out, man, they really love their dental carrier and that's what's working best for their employees. But most of the time we can figure out a way to at least consolidate those bills down a little bit, especially if they have a different carrier provider for each and every benefit that they're offering.
Yes, and there are some other caveats in there too. I know another thing that we had uncovered. Remember when we talked to the group that their group life insurance, which was employer paid, was based on anniversary date of their age.
Oh yes,
and so that person had told us that they were spending hours on their bill trying to reconcile because they had to go in and look at everyone that had a birthday on that month to possibly usually increase every 5 years. But, just something as simple as seeing something like that and saying, let's change it to policy anniversary date.
Right.
There's just so much. You just have to be creative nowadays. You have to be so creative with health insurance and the cost and the time that everybody's spending on that. You just have to really be creative.
And I think that that's, again, a reason why you need to have a good relationship with your broker. If that client wouldn't have shared that with us, because that policy was probably written 15 years ago, they've got a great rate, they've got a great benefit. So there was really no reason for you and I to change that benefit for the employer. But if she would have not brought that to our attention or hadn't have felt comfortable bringing that to our attention, we would have let that continue on versus, she let us know about that and we got that changed within the next month. We did a policy change for her and got that changed to where it was aging correctly. So I think it's just really important to have that relationship with your broker and, be able to say, this is costing me a lot of time. What can we do? And sometimes it's like, oh, I hear you. There's nothing we can do about it. But more times than not, we can figure something out.
I agree. You just have to have the right set of eyes on it. I do know a misconception because you brought up, somebody having an employer paid life insurance for the last 15 years, and we run into that all the time. But I encourage people, Enlighten Benefits encourages companies to shop those benefits out every 3 to 5 years.
Absolutely.
There are new rates out there, new guaranteed issue amounts that could come into play. Just even changing carriers from one vendor to another is going to create that open enrollment for people who want to buy additional life insurance. And when I say open enrollment, I know we've talked about it in other podcasts, but allowing your employees to take on additional life insurance if they've had change in medical history and have had some kind of diagnosis. The
other reason I think it's important to potentially look at consolidating your bills is for that coordination of benefits. For example, if you have your life insurance with one carrier and maybe your short-term disability and long-term disability with 2 other carriers, then you could really be missing some opportunity there to dovetail benefits. So if someone goes on, short-term disability and then they're not able to return within that allotted period of time, and now it's time for their long-term disability to kick in, if those 2 product lines are with different carriers, you're not coordinating those benefits. And it's really just keeping on top of it to ensure that you as the HR or you as the broker are now starting that next claim, whereas if they were all together, then it would just roll right into each other.
Right. And just to break it down even simpler, with the continuation of benefits, if you didn't have that and you had it with 2 or 3 different carriers, that means that you're going to have to fill out 2 or 3 different claim forms.
Right.
So the ease of that being that it's just you don't have to keep resubmitting that paperwork, which is going to make it easier on employee, employer, and broker.
Yeah. Another thing that I run into with human resources team, and by team, I mean, sometimes, it's the office manager, sometimes it's the controller, we just have different people do different roles, within the organization, is additions and terminations of employees, especially for those groups that have a lot of ads and terms. If you're in an industry that you have a high turnover, you can't help it. But sometimes the pain point within that human resources department is, I hear them say, my goodness, I eat up half of my week just by adding people and terminating them and going on to the various portals. Within our organization, I can't speak for every brokerage, but within our organization, we do that for our clients. And sometimes, we find that clients like to do it themselves, and that's completely fine. But just working with the HR team and figuring out what's best for them. But sometimes, again, if you've got 8 different carriers, you're going on to 8 different carriers to add someone or to terminate an employee. That's taken a lot of time. And B, that there is so much room for error, because if you get a phone call in the midst of terminating those benefits and then you don't pick up where you left off, now you've just, continued that person's benefits, and you're paying for it unnecessarily.
Yes. And we find it's very common for people who do that manually. I mean, there are still some people out there that are just comfortable with the paper trail, and I think it's the time in the year is coming where everyone will be doing all of that electronically. And that step to take it from paper to electronic can sometimes be a little scary for somebody who's been in the position for a while. And I'm just going to include myself in that, because if I had to switch over to the technology, which you've tried to make me do several times, I just have anxiety. It's kind of overwhelming for me. So
you're getting there though.
I'm doing a lot better. I really am. But, you would have to sit with that person until you got them comfortable with the changes, or they could simply just email you those paper forms and you could go in and do the terminations yourself.
I think that there's pros and cons to both sides, and again, it's really just figuring out what's best for the organization. I do think that there is some comfort for me, for groups that are growing, to utilize technology, just because, like you and I, we own a license so that all of our employers, if they want to, can enroll their employees through a nice, crisp, clean online enrollment portal. So there's only one place to add, one place to term, and then we connect that portal with all of the additional carrier sites, or we handle it in-house. But again, as you're growing, sometimes it's hard to keep up, with all of the paper trail. And for me to just house everything in one technology space is a lot cleaner, a lot less room for error. But again, I know that some people prefer paper. They like to touch it and feel it and, go back 2 years later and say, no, we elected this, and be able to point to it. Whereas we could always pull those data feeds and we could take a look at that online. Some people just like the paper. So I think the point of that conversation is just whatever the employer is comfortable with. If they want to go paper trail, we'll take you paper trail. Now, one thing I'm really getting away from is all of the different paper enrollment forms. Again, I think that there's just too much opportunity for one lost piece of paper, and then that employee does not get enrolled in the proper medical coverage. So if we do paper, I really prefer, one universal form, so that it's just check, check, check. You've got all the employees' information at the top. You've got your disclaimers, your compliance documentation, and then one signature.
I agree. I mean, that is, like I said, if you look at the way that the platforms make that so simple, I think you would really like it if you haven't ever looked at a platform enrollment. I know for employee, the ease of having it on a website or on their own secure portal that they can look at. I like the idea the other day whenever we were sitting in front of the company and you said, employer information can be on there too, like
right.
Their employee handbook. You can include a summary of benefits of all of their medical plans with just a simple click on that PDF. I remember, I don't know whether you do or not, Megan, but it was probably 2 or 3 years ago that your brother, we have to help our family, right? And so when they have an insurance question, whether it be Medicare, group benefits, whatever it is, at that Thanksgiving dinner, we always have to put that insurance hat on. But your brother had came to us with his packet from his employer, and oh my gosh, that book had to have been 60 to 70 pages wide. And him working in the position that he was, number one, is not going to read that manual. And number two, doesn't understand what he read.
Right.
So, if you're, and I think of the guide to Medicare handbook that is also extremely thick. But having that packet and you as an employer have to put that in their hands, I understand that. But if you were putting it on a platform, then it would definitely be a lot easier.
Especially, I think it's also easier for the employee to refer back to as well. I mean, I can recall my time back at corporate America when, I would go through those enrollments and they would give me that packet. And it was like, yes, that was great information. And I did look through a lot of it, not all of it, but I did look through a lot of it to understand what I was signing up for. But then, 6 months down the road, whenever I needed to have a procedure or, my kid needed to have tubes put in their ears, then I'm going back. Now, what did I do with that packet? And 9 times out of 10, I've misplaced it or we've moved or, whatever. I could never find it. That's one of the other reasons I really like the enrollment online, because then the employee has that app on their phone or that, tag on their desktop where they can refer back to those summary of benefits or, that compliance statement that they signed or whatever. They always have access to it. So I think it's also not only beneficial for the employer to be able to compile everything in one space, but then also for the employee to refer back to, what did I sign up for? How much is this costing me every month? And then subsequently, what are my benefits?
Yes. And I think that Enlighten Benefits, that's one of our passions, is to, have a relationship with their employees where they're comfortable talking to us about, the scenarios of family changes and births and all of those types of things. It's like they need to be on a comfort level with their broker, be able to call them or text them whenever they have a problem. We pride ourselves on the golden rule and always being available with customer service first and foremost. But I feel like also we build a relationship with the HR team too, as we want to be one of you. We want to take as much off of your plate as we can and always be available to you. And I feel like when I go into a presentation with a new group, I always like to almost present a resume and I'm applying for a job. Right. And we treat it that importantly, to be blessed to be a part of your organization and be able to sit down with your employees and have those difficult conversations that you may not be able to have.
Or may not want to have.
True. Sometimes we can learn way more than we want to. We could do a whole nother podcast on those scenarios. Yeah. But it's all about saving time and money. I mean, just to put it all in one couple of words, but I pride ourselves on, that's really our goal, is just to be that one-on-one consultant with you. And, we run into a lot of situations where that HR team will say, we've had the same broker for the last 15 years, right, where we're happy with what we've got. But at the same time, I know you agree with me. It never hurts to get a second set of eyes on that, because it's so easy to just keep renewing what you have year after year after year, and not make changes. It's obviously that's the easy route to go, okay. But sometimes if you get a second set of eyes on it and now you have two people competing for your business, it's a win-win for you, employer, to have two sets of eyes on there, and one of them may be comfortable with what you had and the other one's kind of given a little pushback on, this is what we could do.
Right. Well, I think that really sums up, or at least scratches the surface of our communication and connection with the HR team.
Yes.
Disclaimer. Subjects that we discuss on the podcast are meant to be used as topics of conversation. All figures given are sheer examples. All information is subject to change and probably has changed since the airing of this podcast. Rates and figures change depending upon the demographic in which you live. Anything discussed in this podcast is our opinion. We do not represent Medicare, any governmental agencies, or any of the carrier partners on the show. Each person should do their own research on the various websites to ensure accuracy.